April is Autism Awareness Month, and it's a time of year where Autism Speaks and other groups, they help raise awareness, fund research, and advocate for the needs of the people, obviously, with autism. And joining us now, Diane Cahill, president of the Autism Coalition of Long Island, and Suzanne Reek. She has a son with autism, and she's executive director of the Nassau-Suffolk chapter of the Autism Society of America. Ladies, thank you very much for the time.
Nice to be here.
First, let's start with some of the math, because it's shocking to me. Maybe the numbers have leveled out in the last year, but if you go back 10 years, forget about 50 years, 10 years to where we are in the last couple of years with the numbers, it seems that there's been an explosion in diagnoses for this. Now, is that because we're finally doing it right? Is it because of environmental measures? Is there an overdiagnosis of it? What have you guys found?
It's a combination. Certainly, there's better diagnosis. Absolutely, I would think that's the first thing. People are more aware. School districts are more aware, the Department of Health is more aware. I think some children must have been misdiagnosed. We have adults now still being diagnosed on the spectrum. So I think that we're doing a much better job. There are people that believe there are environmental triggers. I like to base my opinion based on science, so I would say it's better diagnosis, and we have a lot of people thinking about it, and that's one of the good things about Autism Awareness Month, that people think about it a little more.
Now, it can cover the whole spectrum of not just the spectrum itself of autism, but also who gets impacted, predominantly males. White males, metropolitan areas, have that where you've seen the biggest clusters?
Certainly more prevalent in males, 2 to 3. As for metropolitan areas and more dense areas, I just think it's the population. It's more dense. I think the national number of 1 in 66 is a good number. It captures a really good idea of what families are dealing with. There's earlier diagnosis. Certainly having insurance reform passed in New York State has helped, so families have access to good screening and diagnosis through insurance.
Well, let's put a human face on this, and Suzanne, let's talk about Joseph. We were saying right before we started, you were a member of the NYPD, and in fact rose to rank as sergeant fire, if I have it right.
Yes.
You said far more challenging than anything you've had to deal with being on the job was raising an autistic child. Joseph, as we said, now 16. What has these past 16 years been like?
Well, it was very life-changing for us. You have a child who you're told at birth is healthy, you know, you get the perfect score, and then at age 2.5, when I was going through 9/11, because I was a 9/11 responder, my son was actually misdiagnosed. So we took him to a neurologist, and we received the life-changing diagnosis that he had autism. We weren't given much, you know, information on what to expect, what to do next. So when I became involved with the Autism Society, I was able to have an avenue to be involved with families directly and to try to make a difference in their day-to-day life and their quality of life. But my son is like having a 2-year-old forever. Unfortunately, he's at the lower end of the spectrum, because you know with autism it's a very wide range of abilities and disabilities for our children. And he doesn't speak. He has very difficult time communicating. He needs constant one-to-one care. And it's just a simple thing like going out to a restaurant or going shopping for groceries is a challenge.
What are the questions, A, that you ran into yourself, but also when families come to you and they're trying to navigate what I understand, at least, there's still a lot of bureaucracy, and parents not just have to be advocates, they got to fight for the kids, because in a lot of cases the local municipalities, the schools don't make it as easy as I know some of the autistic families would like them or need them to be.
Well, it is very challenging. In fact, there's not a lot of resources available, and you know, with our a personal story about my family is that we laid out over $100,000, about $112,000, to put him into a program that was appropriate for him. You know, we had a very difficult time. We had to sue our school district twice at a very high cost. It was our pension money. You know, I put all my pension money on the line to try to get the best place for my son, to make him be able to be the best that he could be. So unfortunately, the family's big stumbling block is that they don't know what's available to them. A lot of the minority communities also have difficulty with languages and accessing the proper services. And you know, my son was misdiagnosed. So we had to seek out better form of diagnosis. Yep. And I think if you diagnose the children earlier, there's a better chance of better success.
And where's Joseph now?
He actually just went into a group home 3 months ago. A lot of my friends and family don't know that. But, it just became where, we couldn't work. My husband had to retire early from his job. He also worked for the police department. And just the challenges, because when they get older, they get very difficult. They get physically aggressive a lot of times. So, we were very lucky to have this resource to us. But it's a very big challenge, and it affects your whole family.
And I can imagine such a difficult decision, to turn the care of your child over to someone else, even though it's probably the right decision.
Well, it is the best thing because, he's lost about 30 pounds since he's been there. They have him on a diet. They have him exercising. But yes, it's heart-wrenching because you have a child who can't speak, they can't communicate, so you don't know how they're being treated. They can't tell you. You just have to think that this is the best thing for them. And in fact, in New York, we have a very high waiting list. There's a very big waiting list. There's not a lot of housing. There's not a lot of day hab opportunities. So that's the things that we'd like to see worked upon, where there'd be more resources and help for the families, because we really deal with my organization of the here and now for a better tomorrow. And, just to be a group that, is able to help one another with, like you were saying, about information and what's available out there. And there needs to be more. There needs to be a lot more.
And the one thing that families have said to me over the years, they said, our kids are going to outlive us.
That's my biggest fear.
What happens when we're gone? Who's going to take care of my son or my daughter, whatever the case may be? I'm sure that's something that's...
It keeps me up at night. I just think to myself, obviously he's going to outlive me. So you just do the best you can and you try to prepare for their future. And, with my organization, I have over 2,000 families. And I know that's the biggest fear for everyone.
So what can people do that, if they're going through this, go back 14 years ago when parents say, what do I do next? And then also, what would you like to see done more, whether it be out of Albany, out of Washington, or wherever else?
Well, I think what I'd like to see in our state, and we have some great groups throughout the state working on it, is we seem to, as long as we keep funding early intervention, because the earliest interventions provide the best outcomes, we need to keep funding early intervention. With school programs, a lot of the school programs are doing better. They're creating autism classrooms. We have 126 school districts on Long Island. We have the Department of Education in the city, districts throughout the state. Every district works differently. You'll have parents that will literally move from district to district for better services. And then we should see good transition services, because from 5 to 21, a person with autism is under the purview of state ed or the Department of Education in the city. When they turn 21, it's like they're slapped in the face, and they go from being in a very structured environment of being bused back and forth to school and having services and staff, to being in the world of OPWDD, where adult services is very challenging, and they are, still trying to navigate this new system the state put in place, the front door. If they have a language barrier, they really can't maneuver it. And then there's very limited access to day hab programs, good day hab programs, that for the individuals that are able to be out in the community and working, that there are those programs preparing them for that, preparing them to be as independent as possible. And then the housing crisis. We have to think it's going to be a tsunami. Where are these people going to be housed?
And finally, Suzanne, what would you have told you 14 years ago that you wish you knew then?
Well, I guess, in the beginning I was in denial when I got my diagnosis incorrectly that he just had a speech delay. And I think that you have to fight hard and you have to advocate as hard as possible for your own child, because that's the only way that you're going to get proper services and make your child be the best that they can be. To me, I was used to being, the police officer that I didn't think I needed help from anybody, but to rely on other people and to get within a network, like say an Autism Society local chapter, where other families will help you, where you can network and you can find the best resources for your children.
Well, it is Autism Awareness Month, and I've found a lot of people, until this comes into their life, don't realize the scope of this and how prevalent it is and the challenges. And I've talked to people very close, that from getting kids to get bused to school, to which schools will open the doors for them, to having to go through all the attorney fights and all the rest. I think regardless of wherever anybody falls in this, it shouldn't be that hard.
It shouldn't be.
And
Life
I know
shouldn't
you
be that
guys,
hard.
I know you guys are working to make it easier for folks, but thank you guys both. I appreciate the time.
Thank you.
Thank you
Our
very
pleasure.
much. Thank you.
We're going to take a look at some local headlines after this, so please stay with us.